Does eating certain foods affect the gender of your baby? No. My name is Candace Fraser, and I'm an OBGYN. I'm here to answer some of the most Googled pregnancy-related questions. Can you get pregnant without having sex? Yes, if you're married, but that happens already. If you were to collect someone's sperm, let's say you want to do your own intrauterine insemination, you got a little turkey baster, and you squirt it inside, yes, that can happen. If you are having oral sex or other types of sex that isn't necessarily penetrative, if you have semen coming close enough to the vagina that they're really excited and motivated and they make their way inside, yes, but again, they would be super sperm. You can get pregnant at any age after you've had your first period. However, there's a caveat. Because women ovulate before they get their period, someone may have ovulated and never had a period and get pregnant. Sometimes it can be very difficult to tell what's pregnancy and what's just a food bug. So basically, some things that you may experience is nausea, vomiting, breast tenderness, maybe some cramping. Sometimes it can just be different things, but the most important sign that we're looking for is that you've missed your period. So anything that can cause direct trauma to yourself, I will avoid. I wouldn't necessarily go ice skating or skiing. I probably wouldn't go on roller coasters, anything that's gonna have like strong jerking motions, any really, really hot bodies of water. So not like a regular bathtub, like a sauna or a hot tub that's really heated. You definitely wanna avoid doing those. If you were super active and exercising, it's probably okay for you to continue, but I wouldn't start CrossFit when you get pregnant. So as far as foods go, you don't want to eat anything that is raw. So no raw meats, no raw fish, no sushi, soft cheeses, so anything that's not pasteurized. Most types of fish are safe to eat in pregnancy. So as far as cold cuts and deli meats, we're concerned about the bacteria called Listeria. And this is associated with preterm labor and miscarriages, and then you can just get really sick. Things that are caffeinated, we give you 1 small regular cup of coffee or tea, not venti, regular 8 ounces cup of coffee or tea. If you just stop cold turkey during pregnancy, then you get headaches and things like that. You don't need to do that. Just cut it down significantly. Alcohol, it is never recommended. Don't do it. Nothing is safe. Just save it up. As soon as you have that baby, someone can bring you that bottle of wine, you're good. Do not drink a glass of wine to induce your labor. I don't know what that would do. It'll put you to sleep. I don't know. Don't do that. How much weight can you expect to gain in pregnancy? I expect you to gain between 25 and 35 pounds. You want to have a well-balanced diet, and in general, you need about 400 calories on top of what you would be eating regularly. So you're not eating for 2. It's just basically a snack on top of your regular 3 meals. Just healthy snacks that you can think of is what you want to add to your regular diet. Sleeping positions. This causes pregnant women a lot of distress. So in your first trimester, even your second trimester, it's probably okay to sleep on your back. So what we get concerned about is as the uterus gets larger, it's going to put pressure on that big blood vessel, the vena cava, which takes blood to the baby when you lay flat on your back. So we say that it's most ideal to lay on your side. However, who can control where they end up when they're sleeping? So what I usually recommend to my patients is just put a pillow just right under your back so that there's more of a tilt. So if you do turn kind of a little bit more while you're sleeping, it's okay. Sex during pregnancy. Do it! You can safely have sex during pregnancy unless your doctor tells you specifically not to. There are some problems that women may have with placental location or problems with the cervix that may make bleeding a little bit more likely. But other than that, yes, you can have sex. The vagina is wonderfully made. So even though you push out a baby's big 10-centimeter head and it seems like your vagina may have just like stretched to the size of, I don't even know, a big bowl, it usually comes right back. As far as stretch marks go, you can try to prevent them, but ultimately it just depends on your type of tissue. There's a lot of products out there that you can discuss with your OBGYN or a great dermatologist, but it's something that you have to start from the beginning and use consistently. And a lot of women, despite what they try, they end up with stretch marks because their skin is stretching, and it's just something you have to do to get your beautiful bundle of joy. Stress during pregnancy is something that I get commonly asked about. So there are different levels of stress. It's just a matter of how much it's affecting you. If you are in a traumatic situation and it's really giving you physical symptoms because of your stress, it can also affect your pregnancy in terms of preterm labor, things like that. But generally, don't worry if life's regular stressors are there, because your baby's stronger than that. Mental health in pregnancy is something that you definitely need to discuss with your doctor, preferably prior to pregnancy. Discuss it with your mental health provider as far as should you continue your medications, should you try to stop your medications. A lot of women can continue their medication throughout pregnancy because that's what's healthy. And so you never want to be pregnant and stop your antidepressants or other medications that you take for any mental illness, because that can be detrimental to your health. You need to take care of yourself. We always want to take care of mom first, because anything that mom experiences can potentially have an effect. Teen pregnancies are a little bit of a different situation, mainly for social reasons. So as a teenager, you're dealing with school and possibly other things that are going on in your home, and it may not be something that you planned on. So there may be other stressors that you're encountering because you're a teenager. You can have a healthy pregnancy the same as an older woman. However, we may want to monitor you a little bit more closely just to make sure you're taking care of yourself the best way possible and that you're safe in your home environment. So I hope that these answers have been helpful, but always remember that every pregnancy is unique. It's unique to the mom, it's unique to the baby. Always consult with your own OBGYN that you have a relationship with to get the best answer for you.